More cases of monkeypox are being confirmed across the United States, and a former FDA commissioner warns that is, it may be too late to control the virus. But the government's top infectious disease expert, Dr. Anthony Fauci, disagrees.
It would have been good to have had a lot more vaccines available early on, but right now we have accelerated that extensively. We had about 130,000 doses at first, another 154,000, and by the end of July, there should be another 700,000 plus.
Now, here in Duval County, there's been one possible case of monkeypox reported and a total of 154 confirmed cases across Florida. News4Jax reporter Janice Harris is live near UF Health, where doctors say they're prepared for monkeypox if it comes. Janice, monkeypox could be confused with another kind of infection?
Mary, surprisingly, it can be. It can actually be confused with a sexually transmitted infection. But doctors here say they are prepared if they ever do have a case. They don't want people to panic, but be aware that monkeypox is in the state of Florida.
These are images of monkeypox, and local health officials believe it's only a matter of time before the virus is confirmed in Northeast Florida.
Have there been any potential concerns where you thought that UF Health maybe had a case that was monkeypox?
We have received potential calls for testing from some of our clinic providers or patients who have come in with suspicious looking symptoms or lesions, if you will, in our emergency department. But so far, we've had alternative diagnoses for all those patients.
According to the Florida Department of Health, in the last 30 days, there were confirmed cases in Broward, Collier, Miami-Dade, Monroe, Pinellas, and Seminole counties. Broward has the most at 24 confirmed cases. Locally in the last month, there is one possible case in Duval County and dozens more throughout the state, totaling 149.
Everything is flu-like symptoms, from COVID to the common cold to the flu to monkeypox.
More confusion is mounting to the virus because it appears like a sexually transmitted infection.
Lesions, particularly around the groin or genital regions.
As doctors remain prepared for the virus, the United States Department of Health and Human Services ordered 2.5 billion doses of a vaccine that can fight against the monkeypox outbreak. Health officials believe it's only a matter of time before there are cases in Northeast Florida.
And many people wonder what would be the steps if someone thought that they had monkeypox. Well, you would go to your physician or to a hospital. They would evaluate you if you possibly have it. They would take photos of the symptoms. The information would be sent to the Department of Health and also to the State Department. They would be contacted, and that agency would authorize testing if they believe it was necessary. While you wait for your results, you'll be put in an airborne and contact isolation area. If you need to be taken care of as far as testing positive for monkeypox, once the diagnosis comes in, you would be treated and move forward from there. Reporting live at UF Health, Janice Harris, Channel 4, the local station.